Hi, I'm Chris Hardwick, consultant gynaecologist at Ross Hall Hospital in Glasgow. Today I'll be answering some of your most asked questions about having a hysterectomy, which is an operation that I've performed thousands of times throughout my career. I understand that this is major surgery and can feel very scary. However, I'm experienced and familiar with this procedure and know how effective it can be in treating a number of gynaecological conditions. If you're having a hysterectomy soon or know someone who is, hopefully I can help you feel as prepared as possible before the surgery. What is a hysterectomy? A hysterectomy is an operation to remove your womb, also known as the uterus. Sometimes the ovaries are removed at the same time as the womb, and you should always have a clear understanding before your surgery if you are having your ovaries removed or not. Similarly, sometimes the cervix or neck of the womb is not removed at operation, and again you should have a clear understanding if your surgeon is planning to remove the cervix or not. Why might you need a hysterectomy? There are several gynaecological conditions that can be treated through hysterectomy. These can be broadly divided into period problems and prolapse problems. Heavy periods are a common problem, and despite there being many possible treatments for heavy periods, many women choose hysterectomy as a treatment. This may be due to other treatments not being effective, or personal choice after appropriate discussion with their gynaecologist. Uterine fibroids are a non-cancerous growth that develops inside the womb. These are a common cause of heavy and painful periods. They can also lead to feelings of heaviness and pressure across your pelvis. Sometimes a hysterectomy is recommended as part of treatment for endometriosis. Endometriosis is a very common condition where cells like those inside the lining of the womb can be on the womb, ovaries, or other organs in the pelvis. It is a common cause of painful periods and pain in the abdomen and pelvis. Adenomyosis is a condition like endometriosis where tissue from the endometrium grows deep into the myometrium, which is the muscle of the womb. It can cause heavy and painful periods and is another common reason for needing a hysterectomy, especially if other treatments have not helped. In some women, hysterectomy is needed for the treatment of cysts of the ovary, and this may depend on the results of investigations such as blood tests or scans. Prolapse of the uterus is a condition which occurs when your uterus slips down from its normal position and bulges into the vagina. Sometimes the bladder or bowel may prolapse at the same time. And lastly, cancer of the womb, ovaries or cervix. Your treatment will depend on the type of cancer you have, how advanced it is, and your overall health. Other options instead of hysterectomy might include chemotherapy or radiation. What are the different types of hysterectomy? There are three main types of hysterectomy operation: laparoscopic hysterectomy, abdominal hysterectomy, and vaginal hysterectomy. Which type of hysterectomy you are offered depends on the condition that you're suffering from, and I will go through these different types of hysterectomy for you now. So what happens during a laparoscopic hysterectomy? A laparoscopic hysterectomy typically takes 1 to 2 hours. It is performed under general anaesthetic, so you'll be asleep whilst it is performed. You would usually receive antibiotics and pain relief as part of your anaesthetic. Your consultant will begin the surgery by making 3 or 4 small incisions across your tummy. They will then insert a laparoscope, which is a long thin telescope with a camera attached to the end of it through one of these incisions. The laparoscope is connected to a monitor that displays images of your womb and ovaries, so your consultant can see clearly when they perform the procedure. Your consultant will remove your womb and cervix, which is the neck of the womb, using instruments inserted through these small incisions. These organs will be carefully separated from their surrounding organs and their blood supply and then removed from your body. Next, your consultant will close these incisions using either specialist glue or stitches. Dressings will be applied to the incisions to protect them. Sometimes the ovaries are removed at the same time as hysterectomy. Laparoscopic hysterectomies are typically the hysterectomy method of choice for period problems, as well as some cancer treatments and sometimes as part of operations for prolapse. An abdominal hysterectomy is again performed under general anaesthetic, as with laparoscopic hysterectomy. It's commonly performed where the womb or ovaries are significantly enlarged due to either cysts or fibroids. The procedure typically takes between 1 and 2 hours to perform. Your consultant will begin the surgery by making a cut that is approximately 10 centimeters long across your tummy. This will either be along your bikini line or sometimes vertically from your belly button to your bikini line. Your consultant will remove your womb using specialist surgical instruments, separating it from other organs in the pelvis and from its blood supply, and then removing it from your body. Next, your consultant will close the incision using stitches. Dressings will be applied to the incision to protect it from becoming infected. Again, at an abdominal hysterectomy, sometimes the ovaries are removed depending on what condition you're being treated for and your age. What happens during a vaginal hysterectomy? During your operation, your consultant will remove your womb and cervix through an incision made at the top of the vagina using specialist instruments. After your consultant has removed your womb and cervix, they will close the incision at the top of the vagina with stitches. Sometimes other operations are performed at the same time for prolapse of the bladder or bowel. The procedure usually takes 1 to 2 hours to perform and is performed under general anaesthetic or sometimes spinal or epidural anaesthetic. What is the recovery period? This varies from person to person and depends on the type of hysterectomy you've had. When you wake up following surgery, you will experience some pain and discomfort across your tummy and pelvic area. This is normal and you will be offered painkillers to reduce the pain. When you wake up, you will have dressings placed over your wounds to protect them and usually a catheter, which is a small tube that drains urine from the bladder into a plastic collecting bag. This is usually removed the following day. The day after surgery, your physiotherapist will encourage you to get out of bed and to walk around to help with blood flow. They will show you a series of pelvic floor exercises that you can perform at home to reduce your pain and improve your mobility as you recover from surgery. You will be able to return home between 1 and 3 days after your operation. It usually takes 6 to 8 weeks to fully recover, although laparoscopic hysterectomy recovery may be faster. During this time, you should continue to perform the exercises your physiotherapist has taught you in hospital. You should avoid heavy lifting and high-impact sport. Try walks or swimming for exercise, but be gentle with yourself as you recover. If your job does not involve manual work or heavy lifting, it may be possible to return to work after 4 to 8 weeks. Your consultant will be able to offer you tailored advice on how quickly you will be able to return to work. Do not drive until you can comfortably wear a seatbelt and perform an emergency stop. This might be anything from 3 to 8 weeks after surgery. After a hysterectomy, you will experience some vaginal bleeding and discharge that can last up to 6 weeks as your stitches absorb. This is normal and your consultant will explain this to you before surgery so that it isn't a cause for concern during your recovery period. You should avoid sexual intercourse for 6 weeks following surgery. If your ovaries are removed at operation, you may experience menopause symptoms such as hot flushes, night sweats or sleep disturbance. Your consultant will usually discuss the benefits and risks of taking hormone replacement therapy to help with these before your operation. Additionally, if the cervix or neck of the womb has been removed, usually you would not need to have any further smear tests. It's important that you're aware that all types of hysterectomy should be regarded as major surgery and all operations have potential complications. It's important that you and your surgeon discuss this so that you can make a properly informed choice about pursuing surgery. We hope this video provides you with the information you need ahead of your surgery, so you can feel as prepared and informed as possible. If you have any questions, feel free to add them to the comments section below. If you'd like to arrange a consultation with me or the nearest consultant in your area to discuss hysterectomy in more detail, you can book an appointment at circlehealthgroup.co.uk.